very well trained. I did 3 years of a rigorous midwifery program for the academics, and then I did spend 2 years with a local midwife as an apprentice. And those couple of years as a midwifery student were intense and full of knowledge and experience and wisdom. And not only do midwives learn the science and stay with current research and current guidelines and neonatal resuscitation or management of hemorrhage, and we do carry medications, we do carry oxygen, we do know how to help babies breathe right after birth. Not only did I learn all of that, but I also learned something so beautiful, which is midwifery wisdom that has been passed for all of humankind. There are just little tricks, there are little tips, and I sometimes say, this is going to sound a little corny, but talk to your placenta and thank your placenta, and then plop, there comes the placenta. So like we bring in a lot of magic and a lot of mystery and a lot of intuition and a lot of our guides. And there's also this saying about midwives is that we are trained to use our hands, but we also know when to sit on our hands. And so I really like to be a hands-off midwife and let labor unfold without intervention and just let it happen. But there are some times that I do have my hands and I do know how to help, and sometimes babies can get a little bit crooked or they can come in a little wonky, and so we'll shake some hips here or there, or just offer a sip of juice.
That's so helpful. Well, and speaking from experience with my first baby coming sunny side up, the chiropractic adjustment that you provided was so helpful for her to then come down the birth canal straight. So your history with being a chiropractor and a very experienced doula comes in handy as well.
Thank you so much. My first career has been as a chiropractor, pregnancy chiropractor, and I've been a pregnancy chiropractor for over 20 years. Although I knew in my heart and in my soul when I learned what a midwife was and what home birthing and out-of-hospital birthing was 20 years ago, I knew that's what I want to be when I grow up, but I was already in chiropractic school. So I do have the added benefit of being able to provide chiropractic adjustments in labor, and I've seen it profoundly affect the position of the baby and profoundly affect the way that the baby's coming down or the way that the mother's labor pattern is. I'm very blessed in that regard. I also take care of clients and their families during their pregnancy, and also up to 3 months postpartum, and then I do have to graduate them out because I do have a very busy practice. But I love being able to provide chiropractic adjustments even right after a baby is born. So sometimes babies have a little bit slower transition, and it's nothing that we need to transfer out for, but maybe they just got a little twisted when they were coming. And I had one baby that came out and actually had a little rib out of place, and so that baby was showing some signs of being discomfort every time the mom would reposition the baby at the breast. And so did a little check, did a little nudge, and the baby was as peaceful as an angel after that.
And that probably would have been misinterpreted as colic.
Totally. Or something
more severe.
Really wrong with the baby when the baby was perfectly healthy and then was nursing well and peacefully when I left. So I'm so happy to have those added benefits. And then also me being a doula for like 17 years, before I even became a midwife, and attending over 600 births. And so seeing so many different practitioners and providers like birth center births and home births, and also seeing doctors in hospitals and just seeing how babies, rotate and spin out into the world, and just seeing so many different ways. So like I am really absolutely living my dream and doing exactly what I was put on this planet to do. I couldn't wait to become a home birth licensed midwife. And again, I'm so partial to midwife, and there's so many options that we have in Orange County as far as where we can birth our babies. One of the reasons that I choose home birth, and some people say, why don't you want to open a birth center? And I really believe that leaving your home is the first possible disruption to the labor process. Getting into a car when you're having contractions, and I'm sure many of you are shaking your head, you're like, that was the worst. Or you make it to your birthplace, it could be the birth center, it could be a hospital, and all of a sudden your labor's done, stopped, stalled. And that's normal, and it's okay. And of course, give it time, patience, integrated, it'll pick back up again. But if you don't need to have that little pause, you don't need to have it. So how about the midwife is white knuckling it on the way to your house, So I've done that a few times, but I always say I'd like to get there sooner than later, way too early than way too late. Luckily I haven't been too late to a birth. And also like after the birth, hospital, it could be 1 or 2 days later that you do put your baby in that car seat for the first time, and you do drive white knuckles home for that first one. Or from a birth center, often you're discharged 4 to 6 hours afterward, and that's really soon when the mom is in her diaper and the baby's in their diaper. And
I remember.
When I'd rather diaper mom and baby and just tuck them into bed and I have this cute little thing where we sing happy birthday to all of our babies before we leave, and then we're the ones that are tiptoeing out with our suitcases of equipment. And yes, there's plenty of equipment. You know, like we're birth ninjas. We go, there's the maternity center, and then as baby's nursing, and you know, mom is having her first meal, like in bed, and dad is right beside them, and they're just bonding as a family. Maybe there's other kids that are, you know, snuggling up too. You know, it's a family event. That my team is deflating the birth pool, and all of a sudden they're like, what? There's one bag of garbage, there's one bag of laundry, and all of a sudden we're gone. And the family has just grown by a new person.
I remember that. A shower, you braided my hair,
oh my gosh,
and
that's right.
tucked me back into bed, and I had a meal, and
yeah.
the baby that I stared at for 24 hours because I couldn't get over the fact that
that was amazing.
I grew a human.
Yeah, I know.
I mean, it's pretty miraculous regardless. So,
and I will never, like, there are some births that are so much more profound than others, and yours was. There's one that has stayed with me for this entire time, and I know it was 12 years ago.
12 years
you
ago.
were this woman was absolutely incredible, and I can still see you. Like, she had this like little outdoor patio area, really high fences, naked, walking and squatting and just
trying
working.
to do qigong. I was trying to.
You were doing everything, and you were so beautiful, and you were so. She never ever doubted herself. You didn't.
I mean, a little
you
bit.
Didn't. Well, you didn't say it out loud. You didn't say it out loud, but like, yeah, you just stayed with it, and you did it.
Yeah, it's the most miraculous thing I've ever been through in my entire life.
It's amazing.
It is. It's the most impactful.
Yeah.
You feel like a superhero afterwards. But I'm sure every mom feels like that.
Of course. Yes, it is. It's the oxytocin high is the highest level of hormones, oxytocin, that you will ever experience in your entire life.
Is that why I couldn't sleep for 24 hours?
When you do it without any interruption to that process, and it's okay with epidurals, and it's okay, and we're thankful for cesarean births and for these interventions when they're needed. If you don't need them and you are able to experience natural birth in its full entirety, physiological, true, normal birth, it is indescribable. And you are on a natural high. You know, just like a runner's high, this is beyond a runner's high. Sleep deprivation doesn't even come into play. No. 2 weeks later is when reality starts.
Is it?
But
okay,
it can last for like a
physiological
weeks.
Yeah.
Okay. It might last for a couple of weeks. And it also creates amnesia, so you kind of forgot about what just happened.
So you want to do it again.
Yep. It's human survival. It's like a conspiracy kind of in the design.
Yes.
Conspiracy of the design.
Yes.
Because you went on to have more children. And
right.
And even I had, like another child. So I had my first at home in water and my second at home in water. So I just have 2 girls and you have 3 girls.
Yeah.
Yeah. And you did it again.
I did it again. So I have a couple more questions that I wanted to ask. Sure. Oftentimes before a birth, you hear about a woman wanting an adjustment to really open up the hips. Is this something that you recommend? Is it something that makes labor easier?
Absolutely.
And even if you're delivering at home or the hospital, do you recommend this for every birthing mama? What is that adjustment called, and is it a specific technique?
Adjustments prior to birth, there's research that shows that it can shorten labor time, it can decrease need for interventions, it can decrease discomfort and pain. It's such a physical process that if a mother has tight ligaments or muscles that are imbalanced or a pelvis that is out of alignment, then baby might not get into the sweet spot and be able to. Babies actually spin through the pelvis to come through, and they can. And like, just for you had a baby that was malpositioned, which added hours
and multiple cervical manipulations.
Hours and increased discomfort. Like, so just that you did it that way. I mean, giving birth to a posterior baby, like, I'm in awe at women that give birth to normally positioned babies, but imagine pushing out a baby that's malpositioned, and luckily baby was able to maneuver through. And yes,
luckily you came to my rescue.
There are some women that can, because they have ample space or because their tissues are, able to stretch and give, they can push out a baby that is malpositioned. But for some other women, it will not happen, and that's when we are thankful for interventions and for other ways that babies can come. But encouraging every single pregnant person to get adjusted in the prenatal time is, of course, I'm very biased. It's so helpful. I got adjusted many times a week. I mean, I was fortunate to have my colleagues that would adjust me anytime,
Yeah.
But I definitely encourage it. It helps prepare the birthing muscles, flexibility and strength and alignment for the baby. We're not manipulating the baby. All we are doing is balancing the mother's pelvis, ligaments, and bones and joints, and also every time that you come in, like with a pregnancy, certified chiropractor, they're constantly empowering you and telling you what the current research is, or helping you just navigate, the cultural conditioning that we have.
Yeah, and natural options.
Definitely the natural options, or even talking about acupuncture. Tell everybody to get their acupuncture during pregnancy, and just to prepare as much as you can. Do everything that you can. I mean, like what we're trying to do is balancing the effects of what society has kind of made us into more sedentary, or that we're sitting a lot around, or computers a lot, or we have forward head position or stuff like that, and we're just trying to balance out all of those more the forces that are pulling us out of alignment and helping us, so there is a technique by pregnancy chiropractors,
is this
certification,
the
Webster technique.
Okay,
so seeking out a Webster technique certified chiropractor is definitely way more recommended.
Yeah.
But even if you can't find one in your area, a chiropractor that specializes in pregnancy or knows about pregnancy is going to really be helpful.
That's huge. And with midwifery care, is it often covered by insurance, or what would you recommend for people?
It's a really good question, and I bet you'll be very surprised that insurance is more and more covering home births.
Yahoo!
So many of my clients are getting reimbursement. So in my area in Orange County, California, most home birth midwives take full payment up front, and after the birth of the baby, then you can submit the claim to your insurance. And we do have a biller that we work with that helps submit the claims and follows up with any denials and that sort of thing. And even prenatally, talking with your insurance company ahead of time and just say, I've hired a home birth midwife, and just put it out there. I'm going to save you thousands of dollars. And I think that's why they're really paying now. I had just this past month, many of my clients that got really thousands of dollars back for their home birth. Okay. So it's great. And even if you have an HMO, you can fight for it, and you can work with this billing person, and you don't know until you try.
Right.
So several people that even have HMOs have gotten their births covered.
It's so awesome.
It's amazing.
It really is. Really is. Well, I'm so excited that we had a chance to talk with Dr. Jennifer Angell here. And if you guys have questions or want to visit her website, bornwithanangel, 2 L's, ANGELL.com. And then please reach out to us if you have any questions, or if there's any other details that you'd like us to look into for you and research. We're happy to share. So thank you for joining us today. Bye-bye.
Thank you. Bye.